So, in terms of the general measures that I've heard both of you talk about today, it is keep your skin clean, keep it healthy. If you're going out in the sun, make sure you use a sunblock, regardless of whether you're light skinned or dark skinned.
Right.
And several of these topical lotions are beneficial, useful, particularly along with sunscreen if they're moisturizing, have vitamin C and other such antioxidants. Did I kind of get it right?
Perfectly.
Everyone's skin is different. So, for example, if you have a patient who has rosacea, which is where they get slight redness or pinkness of the face, central face, their skin tends to be more sensitive. It tends to be more dry. And so I think it's important to understand the baseline. Some people may have very acne-prone skin, very oily skin. And so therefore, your face wash, for example, has to be appropriately used. So if you have very oily skin, you need something that's more of a deep clean versus if you have a more dry skin, more sensitive skin, maybe a gentle cleanser instead. So it's important to, I think, speak to a specialist so that you can understand exactly what your skin type is. I've seen some patients who, for example, may have rosacea, and that's the redness of the face, and they will use like tretinoin topically, which is a retinoid, and a strong cleanser. That's only going to exacerbate it. And there's certain things that are linked to diet. Diet's a very hot topic. So, for example, people who are acne prone, who eat high sugars, will probably tend to have worsening of their acne as well. If you have a patient who has rosacea, then that can be worsened if they, for example, eat spicy foods, consume alcohol, enjoy coffee or chocolate. There's a whole host of things that can flare the skin. So diet is actually being kind of researched a lot more now, because I think there's an integrated model for looking at the skin, not just as the skin by itself, but in conjunction with other parts of, I guess, the ecosystem, really. And so I think there's a lot of things that people have to be aware of about their skin and modify their lifestyle, their diet, and so forth accordingly. And just to add one comment on the skin cancer side, there are certain types of cancers that are present that are more prone in patients of skin of color or darker skin tone. So, for example, for melanomas, there's a subtype called the acrolentigenous subtype, which is actually found less in fair-skinned patients and more in darker skinned patients, more so in the hands and feet. And so there should be kind of an awareness of what growths are on the body, and if there's any signs such as pain, bleeding, and so forth at the site, or any changes to a mole, because there are certain tumors that can be found that are independent of skin tone or skin shade as well. So that's more on the oncology side of it. But the key thing is to know that one has to be in tune with their skin.